Take an entire campus. We have 43 acres here, and that would not just be a hospital, but it would be an entire medical ecosystem, a healthcare ecosystem, hence the name Medicities.
Hello, my name's Kavita Kumar. I'm a 6th year MBBS student studying at James Cook University, Townsville, Australia. As part of our course, I completed an 8-week clinical elective at Medanta the Medicity in Gurgaon, India. So this video will summarize my experience at the hospital and also showcase some of the services and facilities available. So now I'll let Dr. Trehan talk for himself.
Hi, I'm Dr. Naresh Trehan, sitting at Medanta the Medicity, Gurgaon, where I'm the Chairman and Managing Director and also the Chief Cardiovascular Surgeon. Medanta was actually created in my mind in 2003 when I started thinking that for India to become a country on its own, we needed to create institutions like the Mayo Clinic or Cleveland Clinic or Harvard of the East, so that we could not only deliver the highest end of care in our own country, but also to be able to create new knowledge, training, and also research to see if we can come up with therapies which are more suited to our part of the world at a lesser cost than we actually are practicing right now. In other words, I wanted India to transition from basically copycat generation to creating your own generation. So that's what was the endeavor. And what we did was we got this 43 acres of land where we planned that we will build an integrated medical city, which is now we are sitting in the hospital, which is 1,500 beds. 700 beds are already functional. The next 700 are coming online. And the whole idea was to match three things. One, the infrastructure should be such that it will not only be a great hospital, but also an institution where research and training could be carried out much along the lines of the institutions that I've mentioned. So that was done first. Then we had to access the technology which will be aggregated in one place which would match anybody in the world. And third was to get the human capital or the thought leaders in different specialties who could do justice to not only their own specialty, but would have reached a stage in their life where collectively they are ready to do the next exploration for India in this endeavor to treat as many people as we can.
So now come with me and we'll meet a few of the doctors who work so very hard to make this place what it is today.
Good afternoon, I'm Dr. Yatin Mehta. I'm Chairman of Medanta Institute of Critical Care and Anesthesiology. In critical care, we have about 150 beds in this hospital, which is one of the biggest critical care department in this country or this part of the world. And we are going to add another 60 beds very soon. I have a big team of doctors. Some of the critical cares are divided into different units, like they have half of it is neuro, then cardiac, then nephro, then gastroenterology and liver transplant, medical ICU and mixed ICUs. One rare thing about this hospital is that all the ICU beds are one-to-one nursing. Hospital-acquired infections or ICU sepsis rate is quite low, and it's comparable to the best hospitals in Australia. Okay, talking about the anesthesiology, we have 23 operating rooms. It's a multi-speciality hospital, tertiary care, so we do every possible surgery, including a large number of liver transplants. This is the second largest live donor program in the world. A large number of kidney transplants, huge number of cardiac surgeries, including robotic heart surgery. We also have a hybrid operating theatre where we have a cath lab in the operating room together. And in the neurosurgical program, which is also an active program, we have a brain suite, which is an intraoperative MRI. So only one in this part of the world again. So where a patient's brain head can be opened and undergoes an MRI scan during the surgery.
I'm Dr. Kulveer Ehlawat. I'm Associate Director Radiology here in Medanta, the Medicity, Gurgaon. Our radiology department has got two MRI, one is 1.5 Tesla and the other is 3 Tesla. We've got 2 CT scans, one is 256 slice dual source, dual energy CT scan and the other is 16 slice Emotion. Both are Siemens machines. Then the department is equipped with 8 ultrasound machines, digital X-ray, CR system, digital mammography, bone densitometry. On an average, we are doing about 50 MRIs per day, about 80 to 90 CT scans, and about 100 ultrasounds per day, about 10 to 20 mammograms. On an average, maybe about 15, same about 10 bone densitometry, and around 500 X-rays per day. The department is running 24/7 and it's catering the indoor as well as the outdoor patients throughout the day.
Hi, I'm Dr. Preeti Tandon. I'm a consultant at the Department of Gynecology and Gynae-Oncology at Medanta, the Medicity.
Well, good morning. I'm Dr. Kastiwal and I'm the Chair of Cardiology at the Medanta Heart Institute. Facilities at the Medanta Heart Institute, we have 4 cath labs, we have 5 or 6 actually echo labs. We do a lot of, we have a wellness center which looks at normal people, and we have a superb heart command center where we look at all acute cardiology, and we have an electrophysiology suite which does all the cardio work, 3D work of ablation and everything. So it's a whole and whole department with everything. We also have a very busy teaching schedule. On Tuesdays the faculty speaks, on Thursdays the students speak.
I am a head of department of minimally invasive thoracic and robotic surgery. We've developed a technology called as keyhole surgery of the chest, which is laparoscopy of the chest. And we do almost all the surgeries in the chest by very tiny incisions, which are of benefit to the patient in terms of shorter hospital stay, better cosmesis, less pain, quicker recovery and quicker return to work. Available in this hospital is that we have the latest robot. It's a 4-arm Da Vinci HDSI robot, which is the latest available in the world. And
Hi, I'm Dr. Himanshu Garg. I head the Department of Respiratory and Sleep Medicine here in Medanta. The services that we offer include general clinical respiratory service in ward service, and pulmonary function testing, bronchoscopy service, pleural procedures including intercostal drains, pleuroscopies, thoracoscopic biopsies, and we also run a very active sleep medicine service here. We have a fully functional 3-parent sleep lab.
Hi, my name is Dr. Prashant Prabhakar and I've done my MD in cardiology. I'm working here as a senior resident cardiologist in Medanta since
Dr. Kataria, and I am the chairperson for Division of Radiation Oncology at Medanta, the Medicity. We have 2 linear accelerators and we have an integrated brachy unit along with our mold room and our accessories of quality assurance equipment. And we've treated approximately 1200 cases over the last 2 years. And we offer radiation therapy as a partner in cancer care along with our surgical oncology colleagues and medical oncology.
I'm Dr. Aruhanda. I'm ENT specialist and I've been in this field for last 20 years.
I'm working as an attending consultant in the Department of Plastic and Reconstructive Surgery here in Medanta.
so it is really a meeting ground for the East and the West. That's what it is.
Ding-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling-a-ling